Hello everyone, my name is Antoinette Lachey Dingle. Today I will be discussing some education on asthma. In this educational video, we will be discussing the pathophysiology, prevention, treatment, monitoring effectiveness of treatment, as well as lifestyle changes to promote health. Okay. First, let's discuss the pathophysiology. In asthma, the dominant physiological event leading to clinical symptoms is simply airway narrowing, also known as bronchoconstriction. This is where the bronchial lining overreacts to various stimuli, causing inflammation and smooth muscle spasms that create severe constriction of the airways. When this hypersensitive patient inhales any type of triggering substance such as smoke, smog, cigarette smoke, burning of wood, or any type of ailment that they're allergic to, it then creates this hypersensitive action, which is triggered by mast cells in the lungs, and it releases histamines, as well as trypsases and leukotrienes and prostaglandins. Histamines then attach to the receptor sites within the larger bronchi, where it causes swelling of the smooth muscle. Then the leukotrienes, they then attach to the receptor sites in the smaller bronchi, and this causes swelling of the smooth muscles that are there. It also causes fatty acids called prostaglandins to travel by way of the bloodstream to the lungs, where they enhance histamine effects, therefore causing us to have this great severe allergic reaction. Histamine stimulates the mucosal membranes to secrete excess mucus, further narrowing the bronchial lumen. On inhalation, this narrowed bronchial lumen can still expand slightly, just slightly now, but allowing air to reach the alveoli. On exhalation, increased intrathoracic pressure closes the bronchial lumen completely, and the mucus fills the lung bases, inhibiting alveolar ventilation. Some of the triggers that we have to deal with, such as allergies, which can be caused by dust mites, cockroaches, pollens, moles, or pet dander, even different types of rodents. Then you have the different irritants that are in the air that comes from smoke from cigarettes, air pollution such as smog, ozone, and others. Then you have wood fires, charcoal grills, those very strong fumes and vapors, like somebody wearing excessively strong perfume. Or such as paint or gas, and scented soaps even. Dust and dust particles that are in the air, and then chemicals, definitely chemicals. Remember chemicals such as household chemicals. When we're cleaning up, mopping floors, we have to be careful of what we use if we have asthma. And then you have your respiratory illnesses that can be a trigger. I can speak highly of that because I have asthma. So when seasonal changes come about, I have to be very careful and be proactive in ensuring that I have my medication, ensuring I'm taking it daily as prescribed. I also pick up on my vitamin C. I ensure that I build my immune system up, and I definitely exercise. I get additional exercise because all of that helps build those lung tissues and helps create for a better outcome for asthma patients like myself. But again, respiratory illnesses such as the flu, sore throat, sinus infections, and pneumonia, those are additional causes that can lead to an asthma outbreak, is what I like to call it. Okay, ways of preventing. How do we prevent asthma? The main way to prevent asthma, we first need to learn just what asthma is and learn all about it and the best ways to control it. That is the best prevention I can tell anyone, is to sit down and talk with your doctor, understand the pros, the cons, the different type of medications, which we will discuss a little bit further in this video, as to have the best outcome for a healthy patient. Again, you want to only use medications that are prescribed by your doctor for you. Okay, identify and try to avoid the things that make your asthma worse. Again, all those triggers I just named. Keep track of your asthma symptoms and the level of control. Normally you have regular checkups with your doctor, say every 2 to 6 weeks initially, but as you become more adjusted to your medication, that the 2 to 6 weeks will then go to maybe so many times a month. so many times a year, maybe 2, 3 times a year. It just depends on how bad your asthma is. Some people have to switch medications constantly until they find that right fit. And again, you have instruments that we use, such as the peak flow meter, which shows us how well air moves in and out of our lungs, or better yet, how well it moves out of our lungs. I'm sorry. And this small handheld device shows you that. So your nurse and the doctor will probably even show you for a moment, but mainly your nurse is going to instruct you exactly how to use that peak flow meter. So treatments, what are some of the treatments? Again, prevention and long-term control are the key in stopping asthma attacks before they start. Treatment usually involves learning to recognize your triggers. It always goes back to the beginning. Learning to recognize those triggers, taking steps to avoid them, and tracking your breathing to make sure that your daily asthma medications are keeping all of your symptoms under control. So you need to keep what's called a journal. Keep an asthma journal as to, when was your outbreaks. Keep up with when your outbreaks are, how severe are they, did the medication work, did it work, if you took a fast acting medication, did it work immediately or was it delayed? And all these things the doctor needs to know. This is how you create your actual treatment plan to help them understand, okay, then this is exactly what I need to do. And in case of an asthma flare-up, ensure that you have your quick relief inhaler in hand, such as your albuterol. Okay, treatment is very, very sincere. It has to be a sincere effort for asthma patients, because one severe attack could be your last attack. So you have to take it very seriously. So let's discuss over some of the medications. Okay, first of all, you have what I call your quick relief medications. First, we'll talk about the short-acting beta agonists. These inhaled quick relief bronchial dilators, because they dilate your bronchioles, okay? Act within minutes to rapidly ease symptoms during an asthma attack. These include your albuterols, you have your ProAir, HFA, your Ventolin, HFA, and there's several others, as well as your Labetalol or your Xopenex. Okay. Then you have your short-acting beta agonists. Those can be used as a portable handheld inhaler or a nebulizer. So I have a combination of those. And these are a little bitty machine that converts asthma medications to fine mist. That's what your nebulizers do. But your little handheld, like Advair, I use Advair personally. I have my personal albuterol, which is my fast acting, and then I have my Advair, which is my long term. And they have different ranges of different dosages. And again, your dosage is based on whether or not how severe your asthma attack is. Then you have also your Atrovent, and like other bronchodilators, the Atrovent acts quickly to immediately relax your airways, making it easier to breathe. And you just use that for chronic bronchitis mostly, but it's sometimes also used to treat asthma attacks, whether it's acute or not. And then you have your oral and intravenous corticosteroids, which are set to actually strengthen your lungs as well as helping you to breathe. These medications, which include prednisones and methylprednisone, relieve airway inflammation caused by severe asthma. They can cause serious side effects when used long term, so they're used only on a short-term basis to treat severe asthma symptoms, because anything with a corticosteroid in it or any type of steroids definitely is a short-term basis use. Then you have multiple long-term medications, so I won't go over all of them. I'll go over the different types, roughly about 8, and then I'll just give you a few names of each and tell you pretty much what they do. But you have your inhaled corticosteroids. These are anti-inflammatory drugs, which include like the Flonase and the Flovent. Those help get rid of inflammation within the lungs. And then you You may need to use these medications for several days to weeks before they even reach their maximum benefit. Unlike oral corticosteroids, these corticosteroid medications have a relatively low risk of side effects and are generally safe for long-term use. And then you have your leukotriene modifiers. These oral medications include montelukast, like Singulair. I take that as well. And you have your Alkalate, and you have your Zyflo. And these both help, all of these help relieve asthma symptoms for at least up to 24 hours. And in rare cases, these medications have been linked to psychological reactions such as agitation, aggression, hallucinations, depression, even suicidal thinking. And as with all medications, you have your good side, your good outcomes, but you also have side effects. Every medication has a side effect, and you just need to be aware of that. Just in case you're taking any other types of medications, your doctor needs to be aware of these things. Okay, then you have your long-acting beta agonists. These inhaled medications, which include Servant and Foradil or Performis, they simply open the airway. Some researchers show that, they may increase the risk of a severe asthma attack, or they may take them only in combination with other inhaled corticosteroids. And because these drugs can mask asthma deterioration, don't use them for acute asthma attacks. So those particular ones are not used for that. Then you have your combination inhalers. These medications, such as your fluconazole, salmeterol, basically what I take, Advair. The Advair disc. It's a combination of medications in order to ensure that I can breathe better. They contain a long-acting beta agonist along with a corticosteroid. And because these combination inhalers contain long-acting beta agonists, they may increase your risk of having a severe asthma attack. Again, that's that side effect. But it works well for me, and I am sure it works well for a lot of other patients. Again, you just have to go through and figure out what works best for you based on doctor recommendations. And then last but not least, I have my theophylline, which they call Theo24. This is a daily pill that helps keep the airways open. It's basically a bronchodilator and a pill. Okay, by relaxing muscles from around the airways. It is not to be used as often now as it was in the past years, because now there's so many different things that are out. Just medications galore. So monitoring the effectiveness of treatment. Again, you have self-monitoring. You have your peak flow meter and you have your spirometer. You need to keep a daily diary, asthma diary, so you can keep track of everything that's going on with your asthma, and so you can update your doctor daily. Or some things be completely unknown, you can call either the help desk, speak with the nurse, or speak with your doctor if you got telecare, and find out just what's going on. But you only know what's going on if you're keeping track, if you have a record. Watch out for signs of asthma getting worse. That's one of the main things why we have to monitor our asthma. We have to ensure that we are indeed getting better and that we're not slowly going downhill. Are we starting to wheeze more? Are we having more trouble breathing? Is going outside getting worse? Going around different ailments. Is all of a sudden you get more triggers? You just have to pay attention to your body a little bit more. And all of those different ailments is what will help you figure out just how to make things work a little bit better for you. Okay, so the things that we're going to cover now, let's discuss some lifestyle changes to promote a better health for asthma patients. First of all, don't smoke. Okay, we're just talking about health promotion. We don't smoke. Don't be around people who smoke. Don't allow smoking in your home or your car. You just have to be aware of your health benefits. You have to know what your triggers are, and that's just a primary trigger. Talk to your doctor. Find out about a healthy weight. Weight is very important for asthma patients, and again, that comes into play with being physically active. Talk with your doctor about being physically active. Actually running, walking, doing something to where you can help strengthen those lungs and at the same time maintain a healthy body. Exercise is a great way to control asthma. Okay, so don't try to get out of working out. All right. Fine. Let's see. Maybe an indoor exercise program. If you're allergic to a lot of things outside, that's a good idea. Again, depending on what you're allergic to, but try to include fresh fruit, vegetables, grains into a healthy diet. A healthy diet is very much on the list for helping to manage that. You need to manage your stress when you're dealing with asthma. You'd be surprised how all the elements of the body work together, and stress is one of the real triggers that can cause an asthma attack. So you do need to know what your asthma action plan is. Feel confident in responding to your symptoms. Basically, know what medication you take. Know when you take it daily. How often is it? Once, twice, 3 times? For me, I take it twice a day. And then I have my emergency inhaler should I all of a sudden out of nowhere come into a trigger. Okay. But pretty much those are the main things that we need to cover. But being that I am an asthma patient, I guess I can say this to end off everything. Life is precious. It's very, very precious. And you don't know how precious it is until you can't breathe. And it's a very scary, shocking thing. I've been there more than once. So definitely talk with your doctor, discuss all the different things it takes to help you get better and to treat your asthma. There's no cure, but we can always treat it and make it better. Take your medications daily. Exercise within limitation. Eat healthy. Maintain a healthy weight. And smile. Get rid of any excess stress because people will be surprised how stress affects us. Our whole body, our temple, our mind, body, and soul. Okay. Again, my name is Antoinette Lachey Dingle. This is my presentation on asthma, and I will also have all of my references and possibly even a PowerPoint that goes along with this to cover anything I might have missed. Thank you, and have a blessed evening.